Yeah, going on. All right, perfect. I guess this is better now. All right, so the O6A, it's a plan that has been out there for a while. It's a PPO plan. And you might not be selling lots of these plans, but if you come across a prospect that has this plan, it's a good opportunity to do a review. Maybe they want to switch to the 311, which will give them the gift back, which might be a better value proposition. And it also gives them the flexibility of being able to pay the same in and out of network. So that's one reason why become familiar with the O6A. And then we have the 00A, which is a plan that has a bit of a stronger dental plan than the give back PPO. This one does not give any return of premium, but it has a low maximum out of pocket at a 3,200 level. And it has a great dental coverage, which covers not just basic, but also major work, such as filling, extractions, crown. Does not cover, it's not going to cover a whole lot when it comes to implants. Even though it covers implant, you have a benefit of $2,500. So that might not be sufficient, but it is a great benefit if they're looking for that strong dental plan and the flexibility of a PPO. So those people are going to gravitate to this one. And he also has the flex card. So if you combine the flex card for $250 and the dental benefits, is a total of $2,750. So it's a great value proposition. Have reasonable co-payments, $0 for the primary and $35 for the specialist, and only 5 days of inpatient hospitalization at $280 per day. So that's that plan. Then we look at the 007. This plan, you probably won't actually sell a whole lot of them. Maybe you won't sell at all. But again, if you come across a person that has this plan, this could be an excellent candidate to switch to the 311 give back plan. This plan was here prior to the 311, and we just decided to keep it because we have a lot of membership. But this plan has a monthly premium of $25, and it doesn't have a return of premium. What was great about this plan is that it was passive, but once we make the give back plan passive, this plan stopped. It became obsolete if you think about the benefits it offers versus the 311. So this is another great opportunity where if you come across a prospect that has Humana, oh, that's great. What plan do you have? They say, I have a PPO. You mind if I ask you which PPO do you have? Oh, I don't know. Well, do you have your card with you? Can I take a look at it? Or can you pull out your card and tell me the numbers on the bottom right corner? And those numbers are going to be the 007. Once you know that, well, I would love to schedule a review. When was the last time you sat down with an agent? I can help you analyze the plan, make sure it's still a good fit for you. It is a great plan. It's a great coverage. But since you had that plan, they have come out with different plans, and you might benefit from updating your plan. Now you have an appointment, and you're probably going to make a sale out of that. So that's that plan. And then we go on to the dual plans. With the dual plans, we have the 304 and the 077. I'll tell you the quick run of these two plans for those of you that are fairly new. The 304, it's going to be people that are looking for the maximum reimbursement on a monthly basis when it comes to the food allowance. It comes with $275 a month. It rolls over. It has $2,500 worth of dental, and it's $0 co-payment across the board. So these are going to be for the people that don't care about the dental work. They care about the maximum benefit they can get on a monthly basis. Then you have the 077. It's a great plan for those dual members or dual prospects looking for dental work. They will get $5,000 worth of dental, which could be a lot more than it could be worth a lot more for them in terms of what it covers. Implants, root canals, dentures, surgery, any major work it's going to be covered. And it also comes with a $250 flex allowance, but it has $150 healthy options allowance. So lower cash on a monthly basis, higher dental. So that's going to be the criteria for determining who goes into which plan. Then you have the dual PPO plan. This is going to be for those dual members that are hesitant about exploring a Medicare Advantage. So you might start them off with a PPO plan. I will highly recommend you, if you're going to sell this plan, make sure you have a member that's a prospect that's full Medicaid, to make sure that they do not incur on any out-of-pocket costs. And also notice that the $5,000 dental benefit does not cover implants. So if they're looking for implants, this will not be the plan for them. They're going to be better off on the 077 HMO. It has $150 food allowance, which also rolls over monthly. So those are the plans. Those are the main plans. We have a few other plans, and we'll go over those in a moment. But it's important to have a good portfolio of options, and not just with one carrier, but with multiple carriers, because that way you're going to be able to close more sales, and you're going to be able to provide more options for your clients. So as an agent, you want to find the plan that's best for every beneficiary, and that might not be the same. So if you have a prospect looking for a single plan with built-in coverage and extra benefits, you're going to look into the Medicare Advantage. If you have a more sophisticated client, higher income level, or higher income and medical needs, they might gravitate towards a MedSup plan. If you want to do at a later time a training on MedSups, we can help you with that. I don't know if that's something that you sell or you want to push, but I can tell you that there's a big portion of the population that gravitates towards the MedSups, and if you don't know these products, you're going to miss out on an opportunity. And if they go with a MedSup, they're going to need a prescription drug plan, and they're probably going to need a individual dental and vision products as well. We have them all. We have the PDPs, we have the individual dentals, we have the MedSup.